Hey, what's up guys? So this is super important. I got a list here of post-op care and I think you guys want to hear this. A lot of you are coming to us to get dental surgery and you're wondering, and you leave here with doubts like, hey, maybe I shouldn't be having this type of pain, or maybe this isn't normal, you know? Maybe the swelling isn't normal, maybe this pain isn't normal. A lot of these things, and I kind of want to touch the subject with our viewers because we are a dental implant-based clinic, so we do a lot of surgery. Therefore, I think this is important. You guys ready for number one? I think number one is proper care. What does proper care mean? Why don't you guys come with me? Proper care means most of the time, don't do anything we told you not to do, which means something you guys tend to do a lot. Come here. Somebody's in there. Run. Proper care most of the time means you guys have nothing to see in there. You guys don't need to like try to open your lips up and try to see in there, or furrow your cheek and see if the wound looks what? Is it gonna look any prettier to you? It looks funky, it looks bad. No need to pull. What you do when you pull is you release, put tension on the stitches that we placed, and something can fail, something can go bad. And if we told you to come back for stitches, then you come back for stitches. So super important to not mess with the area, guys. Super important, okay? Now, another point here, and I think it's super important, is oral hygiene. So this is a hard topic because it's not easy to clean after a surgery. Everything hurts. I don't want you brushing hard, but I do want you to do something like saltwater rinses, you know, where maybe you're not so rough on the area. Most of the time when we're done with surgery, something we do is we give you a little syringe and we tell you to, Dr. Diego will probably tell you, but I most of the time tell you, just gently make pressure on the gums. If it's a saltwater rinse, that's perfect, that's good enough. Come on guys, Dr. Diego's a little loud sometimes. You know what? Activities. People are like, hey, what can I do, you know? How fast can I go out running? So let's wait at least a week for activities. You want to be at rest. Usually, and I tell this to everybody, tonight you open Netflix, you open Hulu, you open YouTube, you watch something that doesn't make you bend over, carry things that are too heavy. You need to try to stay at rest. That's the key. Being at rest after surgery is so important, you know? Now, is some bleeding expected? Definitely. Some bleeding is gonna happen, and that's normal, you know, that's okay. Swelling is definitely gonna happen. The third day is usually the worst, but swelling's okay, and I've told you guys this before. You swell, and that's just part of your natural response of your body. Everybody swells, and that's okay, you know? It's your body healing. So, oh, this one's good, guys. Discomfort is to be expected. You just had a huge surgery, you got your gums cut a little bit. I'm not gonna go into the subject of what we did exactly or describe it because it's kind of bad sometimes. But yeah, some discomfort is to be expected. And if you take the stuff we gave you, which is antibiotic, painkiller, and anti-inflammatory, you should be fine. You shouldn't have a problem. It's just the way the cookie crumbles, I guess.
And that's the way the cookie crumbles.
So please, another important thing that I see here and is super important for me to note is, and I kind of just said it, if you were prescribed medications, please stay on them. Why wouldn't you know? There's patients who don't like painkillers or antibiotics and they're like trying to stay away from it or not follow instructions because of it. Don't do that. It's super important that you do. Which leads us to the topic, guys, no smoking. I've had probably in the last hundreds of surgeries, some patients walk outside the office and start smoking, and then those same patients complain that they're in pain. It's out of my hands, guys. I can't control everything you do. I can only tell you what's best. It's up to you if you follow instructions or not, but that's why this post-op video is so interesting, so important. So guys, Did we talk about bruising? You're gonna bruise a little bit. If you swell bad, you're gonna probably bruise. Stitches, most of the time we use self-dissolvable stitches. They're gonna go resorbable stitches. They're gonna disappear within 3 to 4 weeks. Unless you come in at 2 weeks and we find it like it's good to be taken out, then we put them ourselves. And that's it, guys, okay? So I think, you know what? I don't even need this list anymore.
Why are we still here? Just to suffer?
I think you guys understand most of what I'm saying. If past a week or past 2 weeks, you're still feeling pain, major discomfort, if something just feels odd, please contact us. Don't wait. No need to wait. Just as I told you before we began this is a journey. This is how you have to look at it. You know, if you're getting your teeth pulled, if you're getting new teeth, it's a journey, it's a process. It doesn't happen from one day to another. Therefore, just bear with it through the process, guys. We're gonna get you through it. The results are really amazing when everything just comes out right. So I think that's all I gotta say, guys. Thanks for watching. This is a cool, different type of video that I plan on doing more often. Sending you guys all love and hope to see you guys soon. Heal well.